to recuperate, that what ended up happening was that pec minor, and again we call it the UCF. What happens is did that get tighter on you? Again, I think everybody has a tight pec minor because of the amount of things that we do, with phones and computers and tablets. Like, what was I doing when you came in? I was on my phone talking to a patient, and I was on my tablet looking at something. So it's the lifestyle that we lead causes you to get this run.
That I sit in is like this.
Yeah, and see how that's going to put that pec minor in a short position. So you're not really doing things where you're lengthening that pec minor like we want to.
That should be my lengthened movement.
Yeah.
And my speed movement should be sport specific.
Correct. Yeah. And so what happens is, and this is, go ahead, I mean to interrupt.
So two questions.
Go ahead, hit it.
Because we talked about the back squat. That fucked me up.
Okay.
Really, but it was the left side,
okay,
which never has been sore before.
Mm-hmm.
So I think there's more activity after I do that flossing.
Mm-hmm.
I think that was good.
Okay.
It was intense.
Mm-hmm.
So you mentioned in our messages that you wanted to see it go from short to long.
Mm-hmm.
So should I just be doing a full squat so that it goes through the butt wink thing?
Yes, but maintaining the 5 Qs we were talking about.
So,
right. So, yeah, more like that. But think about chin tuck, neck long, chest wide, ribs down, pelvis relatively even. So, yes. So, see, that's where you're now going to become, and this ties in, I also think, to your the pec minor issue, is remember how we were talking about like those thoracic sausages? Well, what happens is those thoracic sausages, or those thoracic erectors, they are what extend you when you're doing something like this. Well, what happens is if this is not allowing you to open up, you're not going to get that extension working like we want it to. So what happens is, and you were saying you were feeling it on like left butt, left hip, left low back. See, what happens is, and this is where we get into like this posterior oblique sling, which ties shoulder to opposite hip. So now if you kind of take a look, where did you say you were feeling things? You were feeling things right in this back part on that left hip, left low back. Now we see we have something going on the right shoulder. All right. So basically what we have to kind of take a look at is, are you doing something to compensate in the back left hip? And now we have exposed, because right here's that pec that we were talking about on the posterior oblique right in the front right there, is did we now expose a dysfunction that you have going on?
So it might be a result of getting more activity to the places that were.
And it's because your brain does not know what fully to do. And that's why it goes back to like that cat camel, the 2.0, is to make sure that you know how to go long and short. So what's happening is, and you did the right thing because you started off in your lordosis, and basically, we don't want you to lose the lordosis completely because it's impossible really to do that just because of the shape of the vertebrae. But we do want to see that you do flatten out a little bit when you're coming back down, because that's teaching those lumbar multifidi to go long. And what it's also it's giving those thoracic erectors time to chill out a little bit. So yes, so now what we have to wonder is, because you were lighting up the lumbar multifidi up here and right here, like right around that thoracolumbar fascia, where were we also saying, okay, now we're exposing where you might have been compensating for a while, and all of a sudden it's going, oh, wait a minute, this is how we're really supposed to be working, and it doesn't work that way.
Ever since I was a freshman in high school and I got into the weight room, I would bench with finishing this one first and then finishing this one.
Yeah.
And this is where I've had all the issues, the bicep tear,
yeah,
everything.
And see, I know you know this already with the anatomy, but what happens is when you take a look that, like the bicep tear, what ends up happening is, don't you have like the bicep that's coming up here, then you have that pec minor that's coming right over here, and this is where this really shows, like here's your pec minor, and then you go right into that bicep right there. And you'll see that it's all connected. And I think, did we talk to you? Oh, yeah. You know how we were talking about that coral pectoral tunnel with you before? That's where I think you have a problem.
So I agree, all that tracks.
Okay.
Last question on
Hit it.
the movement selection. Is it okay that I do?
Yeah.
Okay.
Yeah,
That
yeah,
doesn't
yeah.
lock it up too much?
No, you're doing okay with that. Because the biggest thing we don't want you to do is to hyper extend your thoracic spine.
Really?
Yeah. So basically, and it goes back to like when I was saying about your sport when they're whatever that the bar or whatever. Basically, what I would love to get you guys away from doing, if I could, was when you're pressing overhead is not to be leaning back as much, because then all of a sudden you're messing with the four curves, because then you've lost that kyphosis.
So at what point, because it's easier on a bar, but when you have the log
Okay.
in front of you, at what point do you peek your head through?
Go ahead.
Does that make sense to you?
Yes, it does. Yeah, it does. So what would happen is if you can keep your head retracted, your chin retracted, and then you're pushing up, then you can let that, because by keeping your head retracted and your chin level, here's your lordosis, here's your kyphosis, here's your lordosis, here's your kyphosis. You're keeping those four natural curves that are supposed to be for load sharing with the different ones. So that's what happens is like when you guys do that, when you all of a sudden you're now losing your thoracic kyphosis. So all of a sudden you're not load sharing like you're supposed to. And that's where I think not just your sport, anybody who does any type of like powerlifting or anything like that, is once they get into something where all of a sudden they get out of like the chin tuck, neck long, chest wide, ribs down, pelvis relatively even, and they lose lordosis, kyphosis, that's where you're setting yourself up for an injury.
So how do you do that on a 12-inch log when it's literally like here and you can't?
See, that's where what I would like to do is sometime I would like to go watch you lift so that I can see, because the competition I was at when all that stuff was going on that I would have really liked to, I was treating different people and I couldn't really watch. So that's why what we want to do, it may be that yes, you may have to get a little bit of that thoracic extension, but then once you clear that point, then you want to restore the curves and those 5 Qs. That's going to be it's impossible in the world that we live and work in to maintain all of those cues. It's impossible. I know all these and I don't do it, and I'll be the first one to admit it. So what happens though, but it matters, can you get back and can you restore them as soon as possible, because then you're not overloading one side of the joint, and that's the problem. Make sense so far? Did I answer both questions? All right. You're gonna come over to the door. And so what I'm going to have you do, the first thing we're going to do to check your pec minor is you're going to have elbow at shoulder height. You're going to walk in, you're going to pivot to your left, and you're going to bend knees and stop when you feel a stretch, okay? Then we're going to do elbow below, and then we're going to do elbow above, and we're going to see what you feel with that. Yeah, and you're just basically using the door to block that movement. So just come into the room, pivot on your feet to that way. Good. Now, do you feel anything in that position in that pec? Okay. Now, bend your knees. Anything there? All right, good. Now, yeah, that's an unwind. Just now bring your elbow down just a little bit. Now, again, walk into the room, pivot to the left, bend knees. What do you feel there? Nothing. All right, so maybe let's check where your elbow's above shoulder height. All right, so maybe you didn't mess up the pec minor, which is good. All right, let's have you lay down on your back. Let's put the camera.
I can't say when I roll, like when I flex,
Yeah.
it's this.
That's what the next.
Tendon right here.
That's the next thing we're gonna check. Okay, you just brought. We're gonna. So what we did was we saw that your pec minor can go long. Now we're gonna see what happens when it goes short. So lay down on your back for me, please, and your head's gonna be up at this angle or this side of the bed. Yeah.
Probably not as bad as I.
Well,
Probably
no.
not as much of a setback.
No. I don't. I'm glad your pec minor can go short, long.
Yeah.
That's what I'm happy to see. All right. So now, what we're going to do to test the pec minor for strength, you're going to roll. You're going to leave your arm down here, and you're just going to roll that forward. You're going to hold that up just like that. Now, what I'm going to go ahead and do, I'm just going to push this down at that angle. All right. Breathe in. Breathe out. Meet my pressure. Any pain.
Yeah, through here.
That's so what happens is you did something to your pec minor when it has to go into a shortened position.
It was about right here.
And see, think pec minor is rolling it forward. So the good thing is doesn't have a problem doesn't have a problem going long, which is good. Now, the other thing is I don't think if you is it like right there? Yeah. 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 Basically, let's just check one other thing here. Hold your arm right here. Breathe in. I'm going to pull out towards me. Breathe in. Breathe out. Any pain with that? Not as much as the other one? Okay. Now I'm going to pull at this angle towards me right here. Breathe in.
Wait, so I'm.
You're going that way. I'm sorry, I didn't explain. I'm basically pulling you out at that diagonal. Aha, got it. All right, so this is going to tell us that this is more of when we tested you here, this was testing the clavicular fibers of the pec major. When we put you at this angle and you felt it right there, this is checking the sternal fibers. So breathe in, breathe out, meet my pressure. And you see how you don't like that. Okay, so you did something to the sternal, just to show you the difference. You did something to the sternal fibers of your pec major. Correct, you got this. Breathe in, breathe out. I'm gonna pull up towards me. See how you can hold that without any problem. All right, so basically the good thing is that your pec minor is part of the problem, but not as much as the sternal fibers of what's going on here. Go ahead and sit up for me, please.
Which is funny because that's where like the echo of the pain
Was that the sternum?
goes through here.
Yeah. Well, if you take a look, and I don't know if you want to move the camera or whatever, they can look it up. But if you take a look at like the direction of like, see, when we were, this is your pec minor. So you did fine with stretching it out, and I'm not really worried about that. But what happens is when we were testing these fibers, not as much these fibers that go up to the clavicle, but when we were checking those sternal fibers, that's when you got your symptoms. So basically, you did something to those sternal fibers when you were doing the press. So
Do you think it was? Because my initial thought was, if I exploded from this position and just went, I didn't load like. I feel like I should have done it on a bench so I could come all the way down because I didn't like load that area properly.
correct.
Yeah.
I would agree that you were basically going from short to short.
Yes.
You didn't go long, and like we've talked about before, bicep's a perfect example. Here's short position of the bicep, here's long position. When you do bicep curls, you don't just work in this short position, you try to go long to short, short to long. But I think what happened with you was that you loaded these in that short position to start with because you didn't come down like that to go to the long position. So you were basically in that short position and then you went shorter.
Right.
All right, and it kind of goes along with our pec minor stretch. This didn't bother if you notice that didn't create any symptoms when we took you long, But as soon as we went and took you short, all of a sudden you couldn't hold it. So, makes sense? If you, I don't know if you have a tear because you tested strong and painful. Usually, if somebody has, that means it could be like a small tear. If you were weak and painful, that tells us it's a bigger tear. If you're weak and you can't hold it all, that means you like have a major tear going on in there. And that's why I don't think that you have any of that stuff going on. All right, makes sense so far? Okay, any questions?
What are my limitations for next week?
Basically, I would tell you, we're going to try not to get you to, we're going to try to get you to work. We want to see if we can work.
Machine press.
Yeah, yes. But it goes back to what you talked about. When you said that how many years ago this started, that you were always finishing left pec before right pec. So we're going to make sure that you're going throughout that whole range to where you're basically taking it long. But then what you're also going to do, and you might have to decrease your weight, I want to see that you try to time it that you finish both out at the same time. Yeah. So it's going to be, it's basically going to be, in my profession, the term muscle re-education gets way overused, that it gets used too much. This is definitely muscle re-education type of thing, because you realistically should be able to do both at the same. So you might be dropping your weight way down, and this is one time where you're going to concentrate on the quality of the movement versus like a quantity of how many you can do to get things done. Yep. So, make sense? Okay, all right. Any questions on that? Yeah. I want to do some dry needling into that area because, and I've probably showed you this before, but what happens is right in here is there's a homeostatic point right in here. And you see this shows the different fibers of going into the sternum. So that's you. Sweet. So, make sense? Any questions? So I think it's more of a muscle re-education type of thing. And we're just going to see what happens.
You got to take 3 more weeks off.
No, I don't think that would really benefit you. Yeah, I don't think so. I would rather see you, like I said, go less weight, concentrate more on motion than resistance. And
the way it feels now, I mean, it's at its worst, it's like a 5 or 6 out of 10.
Right.
So it's workable.
We're gonna watch if you get any discoloration. And so right now I didn't see anything when you were doing like the stretching, the pec minor stretching. So let's get you to lay down on your back for me, please. You need another pillow or are you okay? Okay. All right. So what we're going to do is we're going to start up in here. And you feel right there. That's one of the spots, even though that's a little bit more in, that's one of the spots that we're going to start with. There's your twitch. Okay. Feel that little twitch you just got right there as well. This pec, we're not going to beat up the pec today because it doesn't do really any good to do that. But we're going to do things to try to basically these areas that we're feeling tension. That's where we're going to try to get, there you go. Okay, let me grab another needle real quick. Any questions, Taylor? All right, good, okay.
I feel better about it.
Good, all right.
I get injury depression.
Well, and it's also kind of normal with like what your sport is or anybody's sport. And it's kind of ironic. You know how I told you I did that concussion course a couple weeks ago? And what was really weird is in the 90s, when someone had a concussion, the protocol was to put them in a dark room and they were not allowed to associate with team members. And luckily they stopped that. But that's one of the things that they were finding out with that is that you take somebody who was like in a group sport and all of a sudden you take them away from all that social interaction and it just,
Why specifically not allowed to interact with?
they thought it was too much stimulation and that if they took that stimulation away, the concussion symptoms would decrease. Let's just say it didn't happen. That's why they don't do it anymore. And what was,
I could see the dark room, maybe. But
yeah, and that's why but basically it was literally like no social interaction until your symptoms went away. So what was happening is people were faking it, that their symptoms went away.
I still do that.
So, and so what happens is, and what was cool about the class is there was a Division I soccer player, a female, and she basically said, that's what they did to me. And she goes, I just said I'm going to fake it because I'm missing my team. Yeah, and that was her social interaction. So, all right, let's just check. All right, we're going to check pec again. All right, we're going to check. This is going to be more clavicular fibers. Breathe in, breathe out, meet my pressure. What do you feel?
Less pain.
Okay, now we're going to go ahead and do sternal fibers. Breathe in, breathe out, meet my pressure. See how you can start to hold that a little bit better. So that's good. So now let me just turn you just a little bit like that. All right, breathe in, breathe out, meet my pressure. Anything there? Turn the other way. Same thing. Breathe in, breathe out, meet my pressure. What do you feel? All right, looks good. All right. So I don't think, I want to check your pec minor real quick. So just put this arm down right here. We're just going to roll this up just like that. I'm just going to try to push down, breathe in, breathe out, meet my pressure. What do you feel? Still a little bit there? All right, so we might, right about there. Yeah, we didn't get that point, so we're going to come up here into this pec minor, and we're going to work that too. But it's also going back to that coral pectoral tunnel. There's a problem. You have some stuff going on at that tunnel, so that's normal. Yeah, it is. And what happens is, and you and I talked about this before, whenever you have something that you'll get like on both sides of the body, you always go back to, an intrinsic core problem, and the multifidi is part of the intrinsic core. So basically what you're doing is you're kind of confirming that you have a intrinsic core problem that we've
This is from the sore low back to this. This is pretty positive feedback.
Yeah, and that's kind of normal. There's your twitch. But it's all connected. So the biggest thing is I've had maybe 2 or 3 people who have torn the pec, and all of them, what they had in common were heavy steroid users. And you're not acting like somebody who has a large tear that needs surgery.
Yeah. So. I'm sure not only heavy steroid users, but low mobility users.
Oh, yeah. Oh, yeah.
Too heavy lifting all the time.
All the time. Yeah, and that's the problem. And see, they're the ones who, even though, which you already know this, I beat everybody, besides intrinsic core. What I'm doing, I'm always telling people, train short to long, long to short, whatever, the exercise is you want to get. And the one guy, he basically, all he ever did was train short to short.
Just heavy, like,
Yeah. And basically He tore both pecs. He had to have elbow surgery because he had chips floating around in there, and it just doesn't work. Your body's not designed to do that. It's like your body's not designed to work long to long either. It's just not what you're supposed to do.
So, do you think there's any place for partial range of motion movements, like even if it's speed work and stuff like that?
I would say yes. When I'm talking about like rehab is when I want people to work more on like the motion, like explore. Yes, yes.
When you're healthy and ready to go, you can start doing some of that.
Right. Stay right laying down. I want to just check your pec minor. Roll. We're going to roll up again. All right. Breathe in. Breathe out. Meet my pressure.
Oh, so much better.
All right. There's your problem. So basically what I think what you did was, I think you jammed your pec major, sternal fibers, and your pec minor in a short position, and it stayed in that short position. That's why when we put you in the doorway and you did this, you didn't have a problem because it wants to go long, okay? It doesn't want you to go short because when we tested pec major strength, sternal fibers, that was going short, didn't like it. When we rolled you up this way, that was checking your pec minor when it was in a short position. So basically, we dry needled you, all of a sudden things feel better. So, all right, questions? All right, you are done, okay? You're welcome. So, and that's why I'm such a big fan